State agencies are an integral part of protecting the food supply in the United States. Each state is unique in how they regulate food products and investigate foodborne disease outbreaks. The duties of state agencies are similar, but the location of work and legal authority varies. In most states, health agencies and agriculture agencies have legal authority to investigate foodborne disease outbreaks and to regulate the food supply. Your state likely falls into this general structure, but specific programs and authorities may differ. Before we talk about how state agencies protect the food supply, let's discuss how they're structured. The type of relationship a state public health agency has with local public health agencies determines the health agency structure. The health agency structure is the organizational and operational link between state and local agencies. The categories of health agency structure include centralized, decentralized, and shared or mixed. Centralized state health agencies provide local public health services that are primarily led by state employees. Centralized agencies do not have any independent local public health units. The state has authority over budget decisions, public health orders, and selection of local health officials. South Carolina is an example of a state that functions under a centralized health agency structure. Decentralized state health agencies are a collaboration between local health departments and state health agencies. They're organizationally independent from one another. Local health units are led by local employees. The local government has authority over budget decisions, public health orders, and selection of local health officials. Massachusetts is an example of a state that functions under a decentralized health agency structure. Shared or mixed state health agencies utilize a shared authority among state and local health services. Local public health services are provided through agencies that are organized and operated by units of local governments in some areas and by the state government in other areas. Texas is an example of a state that functions under a shared or mixed health agency structure. In contrast to the health agency structure, the agriculture agency structure is very different. State agriculture agencies do not have extensive statutory or operational ties with local governments. They may have regional offices and laboratories within a state to assist local governments and businesses, but the legal mandate and practice to work with local governments is not the same as health agencies. Agriculture agencies do not usually have legal or operational interactions with local governments, such as local health agencies. Regardless of how the organizational structure differs among states, state-level agencies coordinate efforts in epidemiology, environmental health, laboratory, and food regulatory programs. Health and agriculture agencies are generally the two agencies that are involved with food safety, foodborne disease outbreak detection, and response activities. State health and agriculture agencies routinely communicate with federal agencies to ensure coordination during multi-state investigations, compliance with food establishment inspections and assessments, and data collection for foodborne disease pathogen surveillance. State agencies are also responsible for reviewing, monitoring, and regulating hazard analysis and critical control point plans, or HACCP plans, mandated by state and federal regulations. In most states, the majority of foodborne disease surveillance and epidemiologic activities take place at the health agency. State and local health programs are responsible for implementing and enforcing laws governing foodborne disease surveillance and outbreak response activities. Environmental health and retail food safety units also have prominent roles in responding to complaints of foodborne disease. They conduct environmental assessments during outbreak investigations and impose control measures during outbreak responses. State health agencies also disseminate information to local health agencies, coordinate multi-jurisdictional outbreak investigations, and provide health education and promotional materials. Local health agencies are an essential part of the national food safety system. Throughout the United States, local public health departments vary extensively. They serve small rural communities with populations of less than 20,000 to those large metropolitan areas with populations of 8 million or more. Local health department operations and resources differ significantly among states due to population size. However, all local health departments have similar roles and responsibilities. Agriculture agencies primarily promote and regulate the production of plant and animal food products within the state. They are tasked with conducting regulatory sanitation inspections at commercial food facilities, such as grocery stores, supermarkets, and warehouses. They also conduct regulatory sanitation inspections at food processing and manufacturing facilities. They may also be responsible for grading meat, poultry, and egg products. Agriculture agencies are usually responsible for environmental health assessments, stop sales, recalls, trace back and trace forward investigations associated with these food products. Programs that are voluntarily implemented by the food industry, such as meat, poultry, and dairy processing establishments, also fall under the jurisdiction of state agriculture agencies. Food establishments are routinely inspected for consumer safety by one or more regulatory agencies, depending on the structure and regulatory authority of your state. Public health and food safety laboratories are generally located within state health and agriculture agencies. Laboratories at health agencies conduct advanced testing on clinical specimens, environmental samples, and food samples. Test methods like molecular fingerprinting are used at state agency laboratories to aid in foodborne disease surveillance and epidemiologic investigation activities. Food safety laboratories at agriculture agencies routinely test water, dairy, meat, environmental samples, and other food and feed products for contamination. They also test these items during outbreak investigations. The Food Protection Rapid Response Teams, or RRTs, conduct integrated multi-agency responses to food and animal feed emergencies in various states across the nation. RRTs are developed through a multi-year cooperative agreement between the Food and Drug Administration, or FDA, and state food regulatory partners. RRTs demonstrate extensive collaboration among multiple disciplines, including partners in environmental health, epidemiology, laboratory, law enforcement, and emergency management at the federal, state, and local levels. The RRTs activate in response to food or animal feed emergencies in their states by utilizing interagency communication, established plans and procedures, and jointly trained staff.